Welcome to today's deep dive on the earliest clues of liver failure. Your liver quietly powers more than 600 essential tasks day in and day out, keeping you alive behind the scenes. Here's the hard truth. Liver failure often advances silently with signals so subtle that most people dismiss them as ordinary discomforts. By the time the obvious red flags show up, you may already have lost as much as 70% of liver function. Today we're unpacking 13 essential early warning signs that research suggests the majority, around 8 in 10 people, overlook. These aren't minor nuisances. They're urgent SOS messages from your body sent before the damage becomes irreversible. If you're new here, welcome to a community committed to practical life-saving health insights. If this resonates, tap the like button. It helps others find this information. Subscribe so you never miss upcoming content that could truly make a difference. And tell us in the comments where you're tuning in from. We love hearing from our global health-minded family. A paradox makes liver disease especially dangerous: the liver's extraordinary ability to regenerate. That gift can also hide trouble, allowing the organ to keep up appearances even while serious damage accumulates, sometimes until it's nearly too late. Let's get into those early warnings, starting with a big one: fatigue and weakness. The bone-deep exhaustion you may have blamed on stress or age could be your liver's first plea for attention. 1. Red palms. Sometimes the most telling clue is right in plain sight on your hands. A diffuse redness across the palms, known as palmar erythema, can point to a liver that's struggling to regulate hormones and vascular tone. Research published in the American Journal of Clinical Dermatology identifies this finding as a dependable marker of liver dysfunction tied to hormonal imbalance and altered blood flow dynamics. As liver function declines, its capacity to metabolize hormones, especially estrogen, decreases. Rising estrogen levels then trigger dilation of the small vessels in the palms, producing the characteristic flushed appearance. The distribution follows a recognizable pattern. The fleshy pads at the bases of the thumb and little finger redden, while the central palm and the fingers are relatively spared. The color change is usually bilateral and symmetrical, with a mottled or blotchy quality rather than a uniform hue. The affected areas may feel warm, and the redness often intensifies with heat exposure, exercise, or emotional stress. Unlike brief flushing from activity, liver-related palmar erythema persists and does not fade with rest. Because it's visible, objective, and tends to appear relatively early in the course of liver disease, this sign carries real diagnostic weight. 2. Unexplained weight loss. When the number on the scale keeps falling without any changes to diet or activity, it can be a sign that the body is cannibalizing its own tissues under the strain of liver dysfunction. Evidence reported in the journal Nutrients links this kind of unintentional weight loss to a triad of driver's muscle wasting, poor absorption of nutrients, and a deranged metabolic state together, pushing you into a hazardous downward spiral. This isn't merely about a fading appetite. A damaged liver loses its ability to properly process and store incoming nutrients, so malabsorption can persist even when meals are sufficient. At the same time, inflammation ramps up energy requirements while undermining the body's capacity to meet them through normal digestion and assimilation. The pattern of weight loss looks different from simple dieting. The hallmark is pronounced loss of lean mass. The body breaks down muscle for fuel when the liver can't effectively manage glucose storage. This erosion of muscle can proceed even with a reasonable caloric intake, making the decline feel both puzzling and alarming. Left unchecked, the process feeds on itself as nutritional reserves dwindle. The liver is deprived of the raw materials it needs for repair and regeneration, accelerating damage and deepening the cycle of deterioration. 3. Mental confusion or forgetfulness. Forgetting familiar names, fumbling with routine tasks, or riding sudden mood swings isn't always stress or aging. It can be a sign that toxins are disturbing brain function as the liver falters. Clinical research on liver disease highlights hepatic encephalopathy as a serious, often overlooked complication. Under normal conditions, the liver serves as the body's chief filter, clearing substances like ammonia before they can reach the brain. When liver performance declines, that safeguard weakens, allowing ammonia and other toxins to accumulate in the bloodstream and penetrate the blood-brain barrier. The mental changes span a wide spectrum. Early on, people may notice poor concentration, mild forgetfulness, shifts in personality, or clumsiness with fine motor tasks. Many describe a persistent brain fog or difficulty retrieving words. As toxic buildup increases, the picture can progress to marked confusion, disorientation, and disrupted sleep-wake patterns. What makes it particularly deceptive is the slow, creeping onset symptoms often unfold gradually, making them easy to dismiss or explain away. 4. Easy bruising or bleeding. When small knocks leave outsized bruises or tiny cuts bleed far longer than they should, the culprit may be a struggling liver that's no longer producing enough clotting proteins. Research reported in the British Journal of Hematology identifies easy bruising and prolonged bleeding as important early warnings, signals too often dismissed as mere clumsiness or the effects of aging. Your liver is the body's clotting factory, synthesizing fibrinogen, prothrombin, and multiple other coagulation factors. As liver function declines, output of these proteins drops sharply, leaving the blood unable to form stable clots when vessels are injured. The result is that even minor traumas can produce significant, hard-to-control bleeding under the skin. The bruises that appear are characteristically larger, darker, and longer lasting than the impact would suggest, and they may show up without any clear memory of injury evidence that even trivial bumps are causing subcutaneous bleeding. Beyond what's visible, the same problem shows up as recurrent nosebleeds, excessive bleeding with dental work, and heavier menstrual flow. Together, these signs point to a liver whose synthetic capacity has been significantly compromised. 5. Itchy skin or pruritus. An intense, unexplainable itch that no amount of scratching can quiet may signal that your skin is reacting to toxins your compromised liver can't clear. Dermatology clinic findings showed that severe pruritus is one of the most distressing yet frequently overlooked manifestations of liver dysfunction, driven by bile salts building up in the skin when normal bile flow is disrupted. When bile handling falters, those salts spill into the bloodstream and deposit in skin tissues where they act as irritants and ignite powerful itch signals. This liver-related itching has a distinct character. It's usually widespread, affecting large areas rather than a single spot. And it feels deep and internal. Scratching the surface brings little or no relief. The trajectory is also telling. It often creeps in, gradually intensifies. Over time worsens at night and sabotages sleep. Many describe sensations like insects crawling under the skin or a burning from within. Because it can mimic allergies or common skin conditions, it's frequently misdiagnosed, and treatments aimed only at the skin offer little help when the real problem is impaired liver function. 6. Swelling in legs and ankles. When ankles start to puff up like balloons and your legs feel weighed down, it can signal that the liver is faltering in its job of keeping fluid balance in check. Evidence reported in The Lancet highlights swelling of the lower limbs as an important early clue, often driven by reduced albumin production and rising pressure in the portal venous system. Albumin made by the liver helps maintain oncotic pressure, the force that holds fluid inside blood vessels. When a damaged liver can't synthesize enough of this protein, albumin levels drop, and fluid seeps into surrounding tissues, producing visible swelling. This edema follows a recognizable pattern. It usually appears in both legs, symmetrically creeps in gradually, and worsens over time. The puffiness tends to be most noticeable toward evening and is commonly accompanied by a sense of heaviness or tightness. Pressing a thumb into the swollen area often leaves a temporary indentation that takes several seconds to fade, classic pitting edema. Such swelling reflects broader systemic strain, including portal hypertension, that drives fluid out of the circulation and into the abdominal cavity and lower extremities. 7. Yellowing of eyes or skin. Jaundice. A yellow cast to the whites of your eyes or a golden tint to your skin is one of the clearest warnings that the liver is failing. Findings reported in the New England Journal of Medicine underscore that jaundice marks a critical point in liver dysfunction and warrants prompt medical evaluation. The culprit is bilirubin. In a healthy system, the liver processes this yellow pigment and clears it through bile. When liver function is severely impaired, bilirubin builds up in the bloodstream and settles in tissues, producing the characteristic discoloration. The earliest clue usually appears in the sclera. Even slight rises in bilirubin show up first in natural light, often noticed by others before you see it yourself. As levels climb, the yellowing extends to the skin, typically beginning in the face, and then spreading more widely. Its importance lies in its measurability. Jaundice reflects objectively impaired liver function. The depth of the yellow hue often tracks with disease severity, making it valuable both for diagnosis and for ongoing monitoring. 8. Dark urine. Your urine can act as a readout of liver health. When it shifts to a deep yellow-brown or tea-like shade, it's signaling trouble in the bile handling system. Reports from the Cleveland Clinic note that dark urine is among the most dependable early clues of liver dysfunction. In a healthy state, the liver converts bilirubin into bile for excretion. When liver performance falters, bilirubin accumulates, spills into the bloodstream, and is filtered into the urine, imparting that darker color. This pattern is distinct from the temporary darkening caused by dehydration. Liver-related discoloration has a characteristic amber-brown, tea-colored appearance and doesn't brighten meaningfully with increased fluid intake. It often looks darkest with the first urination of the day and may carry a strong, unfamiliar odor. The hallmark is how steady and progressive it is. While dehydration resolves quickly, once you rehydrate, liver-driven dark urine persists and may slowly intensify. It frequently appears before more obvious changes, like jaundice, offering a crucial early window to act. 9. Abdominal discomfort or pain. A nagging, dull ache beneath the right rib cage can seem trivial, yet it may be your liver signaling distress. Studies reported in Hepatology International point to right upper quadrant discomfort as a frequently missed early marker of liver inflammation and enlargement. The liver itself lacks pain receptors, which helps explain why liver disease can advance quietly. Pain arises when an inflamed or enlarged liver stretches the sensitive glissons capsule that encases it. People often describe the sensation as a stitch or persistent soreness tucked under the right ribs. The location is remarkably specific, the upper right abdomen just below the rib margin, and the ache may radiate toward the right shoulder or into the back. Intensity can range from a steady mild throb to sharper bouts that flare with deep breaths, or when lying on the right side. The danger lies in how easily it's dismissed as a muscle pull or simple indigestion. Notably, the discomfort often intensifies after alcohol or fatty meals, and can be accompanied by a sense of abdominal fullness or bloating. In 10. Nausea and vomiting. That unsettled stomach may not be about last night's dinner. It can be your liver sounding an alarm. As waste products build up in the blood, the body reacts to a toxic internal environment it's trying to expel. The American Liver Foundation notes that nausea and vomiting tied to liver dysfunction are often mistaken for routine gastrointestinal problems, which delays proper care. When the liver can't clear toxins effectively, those substances circulate and stimulate the brain's nausea centers. This isn't a fleeting bout of queasiness. It's a persistent, rootless sick feeling that lingers without a clear trigger, reflecting a continuous low-grade intoxication the body recognizes as dangerous. The pattern differs from typical stomach-related nausea. It frequently feels worse in the morning, can come with a bitter taste, and often shows little connection to meals. Many describe a steady background queasiness, interrupted by stronger waves, especially after fatty foods that demand more from a compromised liver. 11. Loss of appetite. When favorite foods suddenly lose their appeal, it may be more than a passing phase. It can be an early signal that the liver is struggling with its digestive workload. Research shows that liver dysfunction directly disrupts appetite regulation and the way the body processes nutrients. The liver produces bile to break down fats and help absorb key vitamins. As liver function declines, this pathway falters and appetite drops. Because the liver also helps regulate blood sugar and handle incoming nutrients, a poorly functioning liver scrambles normal hunger cues, blunting and confusing the urge to eat. This loss of appetite tends to creep in quietly. You may find yourself serving smaller portions, feeling full sooner, or simply thinking about food less often. At first, the change can seem harmless, even welcome, but it quickly becomes a trap. Eating less deprives the body of the very nutrients required for liver repair, further weakening liver function and suppressing appetite even more. These shifts in appetite commonly travel with changes in taste and smell. Foods may seem oddly different or off-putting, and mild nausea can accompany meals, reinforcing the decline in interest in eating. 12. Fatigue and weakness. Persistent, unshakable exhaustion is often the earliest red flag of liver trouble according to research in clinical gastroenterology and hepatology, yet it's the symptom most people brush aside. As liver function slips, the organ's ability to clear toxins from the bloodstream falters. Those accumulating toxins disrupt cellular energy production, leaving you chronically depleted. This isn't ordinary tiredness. It lingers despite a full night's sleep and commonly intensifies as the day wears on. Many chalk it up to age stress or a packed schedule, reaching for another coffee while missing what may be the liver's first plea for attention. Findings show that even a modest decline in detoxification capacity can allow enough toxin buildup to trigger profound fatigue that seeps into every part of daily life. This goes beyond end-of-day weariness. It's a level of weakness so deep that routine tasks start to feel daunting. Before we wrap, remember this. Your body rarely shouts. First it whispers. Those small, strange changes you've noticed aren't inconveniences. They're messages. Listen to them act early and partner with a qualified clinician to get the right evaluation and care. The liver is tough and forgiving, and with timely intervention, you can change the trajectory of your health. If today's video gave you a clearer roadmap, drop a comment telling us what you'll do next. Book a checkup, review your labs, or make one concrete lifestyle change this week. Share this with someone who needs a nudge to pay attention to their liver, and tap the like button so more people see it. For practical science-backed guidance you can use, make sure you subscribe and turn on notifications. We're here to help you protect the only body you'll ever have, starting with the organ that works hardest for you every single day.